I'm gonna screen my area. I'm gonna screen my camera. I'm gonna close the door for privacy and wash my hands. Hello, my name is Feruza and I will be doing your exam today. Can you tell me your name and birthday?
Melina Marchenko, December 5th, 2005.
Okay, patient remembers her date of birth, so it means that remote memory is intact. I'm gonna ask you a few questions, but before I wanna review your vitals. Your blood pressure is 112/68, your temperature is 97.7, heart rate 82, respirations 18, and O2 sat is 100%. Your height is 5.5 and your weight is 112 pounds, which gives us a BMI of 18.6, which is normal. I'm gonna start my assessment, and first I will ask you a few questions. Can you tell me what year it is?
23.
And where we are?
Doctor's office.
And who is the president?
Biden.
Good. So patient is alert and oriented to person, place, and time. She is calm, she's cooperative, her speech is clear and fluent. We're gonna move and I'm gonna do cognitive assessment with NIH scale. Can you identify what's wrong with the picture?
The sink is overflowing and the boy is falling off the chair.
Okay. What's the object?
Glove.
And this?
Key. Cactus.
Good. And can you read this sentence for me?
You know how.
And this?
Near the table in the dining room.
Okay, that's good. So cognitive function is intact. I'm gonna assess for abstract reasoning. So can you tell me how an apple and orange are similar?
They're both fruit.
And how they're different?
Different color.
Okay, and if we are in New York State and you need to be in Florida by this evening, what mode of transportation would you take?
Plane.
Okay, good. The abstract reasoning and judgment are intact. I'm gonna do serial 7. You start at 100 and subtract by 7 a few times. So 100 minus 7.
93.
Minus 7?
86.
Minus 7?
79.
Okay, very good. So cognitive function is intact. I'm gonna have you remember 3 words: apple, penny, table, and I will ask those words later in the exam. Apple, penny, table. Can you recite?
Apple, penny, table.
Good. All right. So we're gonna move with our exam, and I'm gonna start with your skin. I'm inspecting. I see the skin is pink. It's intact. I'm not seeing any lesions, no hyperpigmentation, no wounds. If I would see a wound, I would note it's bad, the drainage, any redness, skin surrounding the wound, but I'm not seeing any wounds. I'm gonna palpate. The skin is smooth, dry, it's warm. I'm gonna assess for turgor, and the turgor is elastic. Can I see your hands? I'm gonna assess for turgor, and the turgor is elastic. I'm gonna check your nails. The nails are pink, they're firm, smooth. Cap refill is brisk, less than 3 seconds. Nails are well maintained, and the nail bed angle is 160 degrees. No signs of cyanosis or clubbing. All right, I'm gonna move to your head, and the head looks normal shape, normocephalic. I'm gonna feel for bumps, no bumps. I'm gonna check your skin, no lesions, no signs of dandruff or dryness. The scalp is white, the hair is full, evenly distributed, normal color, no signs of alopecia. I'm gonna palpate your temporal region. Any pain or tenderness?
No.
Okay. The pulse is +2 bilaterally, and I'm not feeling any cording. I'm gonna assess your face now. So I see the face is symmetrical. The nasolabial folds and corners of the mouth are symmetrical. The outer contours of eyes line up symmetrically with ears, and it's a normal finding. I'm gonna assess cranial nerve number 5. So I'm gonna assess cranial nerve number 7. Can you close your eyes and smile and puff your cheeks and show me your teeth? Okay, and frown. Okay, cranial nerve number 7 is intact. And I'm gonna assess cranial nerve number 5 now. Can you clench your jaw? I'm gonna palpate the masseter muscle, and I'm feeling symmetry here. And I'm gonna assess sensory function of cranial nerve number 5. Close your eyes. Can you tell me where you feel?
Forehead, cheek, chin.
Okay, patient was able to identify ophthalmic ophthalmic, mandibular, and maxillary regions correctly. So cranial nerve number 5 is also intact. Now I'm gonna move to your ears. First, I'm gonna note the location, the position. The ears are symmetrical. The skin is pink, dry. I'm not seeing any swelling, redness, no drainage. I'm gonna palpate the mastoid process, the tragus. Any pain or tenderness?
No.
Okay, good. I'm gonna inspect the ear canal, and I'm seeing the ear canal is patent. I see some cilia, small amount of serum, and no drainage, no fluid, no redness or swelling in the ear canal. I'm gonna pull up and back and assess your tympanic membrane. The tympanic membrane is flat, translucent, no drainage, no lesions, no redness. I see the handle of malleolus, and I see the light reflex at 5 o'clock. I'm gonna assess cranial nerve number 8, and we're gonna check your hearing, okay? So cover one ear. This ear. I'm gonna whisper a phrase.
It's dark outside.
Good, and I would do it bilaterally on the same ear. I'm gonna assess for lateralization. We'll do Weber's test. And can you tell me if you hear the sounds
Yes.
equally in both ears? Okay, there is no lateralization, which is normal finding. So I'm gonna do Riney test. I'm gonna put the tuning fork here. Tell me when you stop hearing the
No.
Okay, can you hear the vibration?
Yes.
Okay, and it tells us that the air conduction is longer than bone conduction, and it's a normal finding, and I would do it bilaterally. So cranial nerve number 8 is intact. I'm gonna move to your eyes now. So first I'm gonna inspect your eyes. Look symmetrical. Eyebrows are symmetrical with even hair distribution. Upper and lower eyelids and palpebral fissures are symmetrical. Eyelashes are everted. I'm not seeing any swelling, drainage, redness, no ptosis, no lesions. I'm gonna inspect cornea. Cornea looks clear, no clouding, no arcus. All right, very good. I'm gonna assess your cranial nerve number 2. I'm gonna give you Rosenbaum test, Rosenbaum eye chart. So can you close one eye and read
4,
this?
2, 6, 7, 3, 9.
And change your eyes.
4, 2, 6, 7, 3, 9.
Good. Your visual acuity is 20/20, which is good. And we're gonna assess for color blindness with Ishihara test. Can you tell me the number?
7, 6, 26.
Good. No color blindness. Since I'm doing assessing cranial nerve number 2, we're gonna assess your pupils. They are round, equal, and the size is approximately 4 millimeters. While we're doing this, we're gonna assess for pupillary light response. I'm gonna shine the light into your pupils, and I see the pupil constrict with direct light, and I see that the other pupil constrict when I shine the light into the right eye, which tells us the direct and consensual light response is intact. We'll assess your cranial nerve number 5 again. I'm gonna, for corneal light reflex, I'm gonna shine the light onto the bridge of the nose, and I see symmetrical light reflex in your pupils. So cranial nerve number 5, Hirschberg test, is good. It's intact. Now we're gonna assess for extraocular movement. So I'm gonna have you look at my finger and follow my finger, okay? All right, so I'm not seeing any muscle weakness, no abnormal eye movement, which tells us that cranial nerves 3, 4, and 6 are intact. Now we're gonna do cover and cover test. Cover one eye, and I see the eye is midline, and uncover, no deviation. I would do it bilaterally on both eyes. I'm gonna assess for convergence. We're gonna test cranial nerve number 3. Look at my finger, and I see the pupils converge and constrict as I move finger close. Now we assess with accommodation. Look at the distance. Now shift the gaze to my finger, and I see the pupils converging constrict. So cranial nerve number 3 is intact. Now we're gonna test your peripheral vision. Close one eye. I'm gonna bring some fingers. Tell me how many fingers you see.
2, 4.
Okay, good. And I would do it bilaterally. Another way to assess for peripheral vision with confrontation, we can close both the examiner and the patient will close their eyes. And tell me when you see my finger.
Now.
Okay, good. The peripheral vision is intact. Now we're gonna we assess the extraocular movement. So now we're gonna move closer to your eyes, and I'm gonna check your conjunctiva. It's pink, it's moist, and sclera is white. No jaundice, no lesions, no drainage. I'm gonna assess your eye closer. I'm gonna assess the internal structures of the eye. First, I'm gonna assess for red reflex. And I see the orange glow fills the pupil. I would do the same on the other eye. And I'm gonna assess the internal eye structure. And I see orange optic fundus. Optic disc is located on nasal aspect, and darker macula is located on the temporal aspect. I see arteries and veins in all 4 quadrants. Arteries are brighter and veins are darker in color. I'm not seeing any hemorrhage or cotton wool patches or nicking, which is a normal findings. And AV ratio is 2:3, which is a normal finding. Okay, so now we're gonna move to your nose, and I see the nose is symmetrical. I'm not seeing any deviation, no drainage, and I'm gonna use my light source to check the internal structures of the nose. Okay, and what I see is cilia is present, no drainage, no swelling or redness. The turbinates are small and pink. The nasal mucosa is pink. No lesions, and it's a normal finding. I don't see any septum deviation or perforation. I'm gonna assess cranial nerve number 1. We're gonna assess your smell. Okay, first I want to check your patency of the nares. Can you cover one nare and breathe in? Okay, good. And the other one? Okay, so nares are patent. Now we're gonna close your eyes and close one nostril. Can you
Coffee.
Good.
Vanilla.
Good. The patient was able to correctly identify the smell, so cranial nerve number 1 is intact. We're gonna move, and I'm gonna assess your mouth and pharynx. Okay, so I look at the lips first, and I'm seeing they are pink, no cyanosis, they are moist. The corners of the mouth are symmetrical. Can you open your mouth and stick your tongue out and move it back and forth? Good. All right, and push against resistance. I'm checking cranial nerve number 12, and it's intact. Can you stick your tongue out again? Okay, the tongue is pink, it's moist. I see papillation, no coating, no lesions. I'm gonna assess the pharynx, and posterior pharynx, and oral cavity. You can put your tongue back. Say ah. Once again, ah. Let me do it like this. Ah. Good. All right, and what I'm seeing is buccal mucosa, sublingual mucosa are pink, moist, no lesions, no swelling. The gums are in good condition. They are not swollen or bleeding. The teeth are good, no dental caries or tooth repair. I can see the posterior pharynx is pink and moist. Tonsils are grade 2, they extend to pillars. Hard palate, soft palate, and uvula raise symmetrically, as the patient says, which tells us the cranial nerve 10 and 9 are intact. I'm not seeing any tonsillar stones, no exudate, no redness, no erythema. As I said, posterior pharynx is pink and moist. I'm not seeing any lesions on the tongue or on oral mucosa. I was able to identify Stenson's duct across the second molar and Wharton's duct underneath the tongue. No lesions, as I said, on the tongue. And I would try to assess for cranial nerve number 10, which is gag reflex, but I'm not doing it, and we're gonna assume that it's intact. Okay, so now we're gonna move and do your skin assessment. So I see, your thorax and, no, first we're gonna do your lymph nodes. So I'm gonna palpate posterior, occipital lymph nodes, preauricular, postauricular, submental, submandibular, tonsillar, anterior cervical. We're gonna do it twice for superficial and deep for deep anterior cervical and posterior cervical lymph nodes, and supraclavicular. Shrug your shoulders. Good. I'm not feeling any enlarged lymph nodes, which is a normal finding. Now we're gonna move to your neck. I see your neck, the skin is pink, it's warm, it's dry, no lesions. Trachea is midline, no deviation. I'm gonna palpate your trachea, and it's midline, no deviation. I'm gonna palpate your thyroid gland. Can you swallow? One more time. Okay, no nodules identified. The thyroid is not swollen or enlarged. I'm gonna palpate for carotid pulses. +2, +2 bilaterally. I'm gonna auscultate for carotid bruits. Inhale. Okay, good. Inhale. And I'm not hearing any carotid bruits. I'm not seeing any veins enlargement or engorgement, no jugular vein distension, normal pulsation. So I'm gonna measure jugular venous pressure. So I was able to identify the pulsation, and I'm gonna draw a perpendicular line. I would do it with the patient laying above 30 degrees. And I have 3 centimeters +4, which gives us jugular vein pressure 7, which is a normal finding. All right, so I'm gonna palpate cervical spine. Any pain or tenderness in paravertebral muscles? No? Okay, I'm gonna have you perform range of motion of the neck, bend forward and back, and on the sides, good range of motion in the back, in the neck. All right, very good. So we're gonna move to your thorax and lungs. So let's see. I'm gonna also assess cranial nerve 11 while I'm doing it. So can you shrug your shoulders? Okay, good. And push against my hand. Push against my hand. Turn your head. Good. And, okay, cranial nerve 11 is intact. All right, so I'm gonna move to thorax. So the skin is pink, intact. I'm not seeing any swelling, redness, or deformity. I'm gonna the inspiration is longer than expiration. Respirations are nice and easy and regular. Patient is not in distress. I'm not seeing any nasal flaring or retractions. No use of accessory muscles. Normal breathing. Anterior, posterior to lateral diameter is 1 to 2, which is normal. No barrels, chest. I'm gonna assess posterior thorax first. Turn back. So same thing here. Patient's respirations are nice and easy. No use of accessory muscles. Inspiration is longer than expiration. I'm gonna palpate. Any pain or tenderness? No deformities. I'm not feeling any crepitus. So I'm gonna perform assess for tactile parameters. Say 99 every time I move.
99, 99, 99, 99, 99.
Good. I feel resonance, and it diminishes as I move down. I'm gonna percuss. Alright, and I'm hearing resonant tones, which is normal, and they diminish as I go down. Now I'm gonna assess for chest expansion. Can you take a deep breath? Good. Chest expands symmetrically, and I'm gonna measure for diaphragmatic excursion. So I'm gonna have you exhale and hold. Okay, and I can hear a change of tone here. And now you can take a breath. Now inhale and hold. Okay, and I can hear the change of tone here, which gives us about 5 centimeters, and it's a normal finding for, you can breathe for diaphragmatic excursion. I'm gonna listen for the lung sounds. Take a breath in and out every time I move my stethoscope. Okay, and I can hear the lung sounds are clear in all lung fields. I can hear sounds from right middle lobe. I cannot hear any rales, rhonchi, wheezing, so normal lung sounds here. I can hear bronchovesicular and hear more vesicular sounds, which are soft, low pitched. Okay, I'm gonna assess for bronchophony. Egophony. Say E every time I move. Okay, and I can hear muffled E. If I would hear A, which it will tell us that there is possible consolidation, and I'm only hearing muffled E. Okay, now I'm gonna assess for bronchophony. Say 99 every time I move.
99, 99, 99, 99.
Good, good. And I can hear nasal 99, and it becomes more diminishing. And if it would continue to be loud or be more loud, it would indicate that there is a consolidation. Since we are here in this area, we're gonna assess for costovertebral tenderness. Any pain or tenderness?
No.
Okay, very good. So you can move, you can turn around. And we're gonna do the assessment of the anterior thorax. So we're gonna assess for chest expansion. And I see the chest rises symmetrically. Okay, I'm gonna do assess for tactile parameters. Say 99.
99, 99, 99.
Good. Now we're gonna listen to your lungs. Breath in and out. Good. Lung sounds are clear, no wheezing, no rhonchi, no rales. Here I can hear more bronchial sounds, which are harsh and loud. Normal lung sounds in this patient. Okay, so we're gonna move to heart assessment, cardiac assessment, and first I'm gonna inspect. I'm not noticing any abnormal pulsation. I'm gonna assess for heaves and lifts. So I'm gonna palpate the base and the apex and the sternal border, and I'm not feeling any abnormal pulsation or thrills. I'm gonna identify 5 cardiac areas. So second intracostal space, right sternal border, aortic area. Second intracostal, left intracostal space, pulmonic. Third intracostal, Erb's point. Fourth intracostal, tricuspid. And fifth intracostal space, mid-clavicular line is mitral area, and I can feel the slight tap, which tells us there is a point of maximal impulse and it's normal. I'm gonna listen for the long heart sounds, and I'm gonna listen with my diaphragm and with the bell, but I don't have the bell on my stethoscope, so I will just listen with diaphragm. Again, aortic, pulmonic, Erb's point, tricuspid, mitral area. And what I hear is normal S1, S2 sounds, no S3 or S4, no rubs, gallops, or murmurs. I'm gonna listen for aortic and mitral areas murmurs with my bell. Lean forward. And then back on the side. Okay, and I'm not hearing any aortic or mitral murmurs, which is good. So now I'm gonna move to assessment of the abdomen. Go ahead and lay down. I'm gonna move the camera closer. Okay. First, I'm inspecting. The abdomen looks flat. It's regular movement, no dilated vasculature, no muscles, no bulging, normal abdomen. Okay, I'm gonna listen for no ascites. I'm gonna, and the skin is pink and it's warm. I'm gonna listen for bowel sounds. Right upper quadrant, left upper, left lower, right lower, and I can immediately hear active bowel sounds in all 4 quadrants. I'm gonna listen for aortic bruit and renal arteries bruits below the xiphoid process. And I would listen with my stethoscope's bell. No aortic or renal bruits. I'm gonna measure aortic span. Was able to identify the pulse on the right. I feel slight pulse on the left, and the measurement is about 1.52 centimeters, which is a normal finding. I'm gonna palpate all 4 quadrants now. First, I'm gonna do light palpation. Any pain or tenderness? And I'm gonna do deep palpation. Any pain or tenderness? Good. And I feel that abdomen is soft, no masses. And the patient said it's not tender. I'm gonna palpate for liver edges and splenic enlargement. So spleen tends to enlarge towards umbilicus. So I'm gonna start here at the umbilical area. And I'm not feeling any splenic enlargement, and it's normal. And I'm gonna have you take a deep breath in, and I'm gonna use hook method. And I'm not feeling, and you can breathe, I'm not feeling any liver enlargement, so it's good, normal findings. I'm gonna percuss the abdomen just to listen, to hear for general sounds. And I hear different sounds, tympany and dullness, and I'm gonna percuss over the gastric bubble, and I hear tympany, and over the bladder, and I hear dullness. And now I'm gonna percuss the spleen, left costal margin, and I hear dullness. And I'm gonna percuss, try to measure for liver span. Okay, I'm gonna start here. Okay, the tone, the change of tone I can hear here. I could hear the change of tones, and it gives us about 7 centimeters, which is normal finding. Liver span is about 6 to 12 centimeters. All right, now we're gonna palpate for inguinal lymph nodes. I will do horizontally and vertically. and I'm not feeling any enlarged lymph nodes. Now I'm gonna assess for rebound tenderness. So we're gonna start in the middle or even more on the left, because right side may be painful if the patient came with appendicitis, for example. So tell me if it hurts when I push or release. Pain? Pain? Any pain? Good. No rebound tenderness. We'll do psoas sign. Raise your leg. I'm gonna push. Any pain in your right lower quadrant? No. Okay, good. And I'm gonna do obturator sign. Bend your knee, and I'm gonna rotate. Any pain in your right lower quadrant? No. Good. No rebound tenderness. Okay, very good. So I'm gonna, since we're doing that, I'm gonna start my peripheral vascular assessment, and I'm gonna raise your leg, and I'm gonna have you rotate your ankle. Good. Rotate. Good. And I'm gonna have you sit down. Sit up. I'm gonna move the camera. Okay. And I see that the color returns immediately. It's pink, so good peripheral perfusion. I'm gonna assess your pulses. I'm gonna assess radial, bilaterally, and brachial, bilaterally, +2 both, and your popliteal, +1, and postevial. Move a little more. This popliteal and pedal pulses, +2 bilaterally, all pulses. Very good. I'm gonna assess for Homan sign. Pull your toes towards your nose. Any tenderness or pain in your calf? No. And I would do it bilaterally. Negative Homan sign. And I was when I was assessing the peripheral vascular, I was doing a Burger's test. Okay, so I'm gonna assess for swelling. No swelling, no edema in lower or upper extremities. The skin is pink, no dilated vessels. When patient stands up, I will assess for varicose veins. The skin is pink, it's warm, it's dry. So good peripheral perfusion. So now we're gonna assess, we're gonna do Allen's test. I'm gonna have you make a fist, and I'm gonna occlude radial and ulnar arteries. Release, yep, and I see the color returns quickly. One more time. I'm gonna release radial now, and the color returns. So it tells us the patient has good collateral blood flow. All right, so now we're gonna move. We're gonna start with musculoskeletal assessment, but first I want you to we're gonna assess your for carpal tunnel. So make your hands like this, and it's a Fallon's test. Push very hard, and tell me if you feel any pain, tenderness, numbness, tingling. No. We're gonna hold for 60 seconds, but the patient says no, so it's negative. And we're gonna do Tinel's test. I'm gonna tap over the median nerve. Any pain or tenderness, numbness, tingling? No. Negative for carpal tunnel. Very good. We're gonna start with musculoskeletal assessment. I'll do upper extremities first. So I'm gonna palpate all upper extremities. So I'm gonna start with hands. I'm gonna assess. I'm not seeing any deformities. The skin is pink, it's intact, no swelling, no nodules, no in fingers, wrists, elbows. Any pain or tenderness? Okay, I'm not feeling any crepitus, so skin is intact. All upper extremities normal, within normal limits. Now we're gonna perform, and I'm not feeling any crepitus. Now we're gonna perform range of motion, okay? So we're gonna start with your fingers. I want you to flex, extend, adduct, abduct. Good range of motion. Can you squeeze my hands? Good. +5 strength, both hand grips are strong. We're gonna move to your wrist, and as I said, no pain or tenderness, no swelling, no deformities, no crepitus. So I want you to flex, extend, and we're gonna check inside and outside. It's for ulnar and radial deviation. Yep, and it's good. And can you rotate? Good. And now make your hands like this. Push up. Good. Push down. Good. And I would do bilaterally. Everything I would do bilaterally. Good strength, muscle strength is +5. I'm gonna assess your elbow range of motion. You're gonna flex and extend, rotate. Good. And I'm gonna assess for muscle strength. Push up. Good. Down. Good. All right. Good strength, +5. I would do it bilaterally as well. I'm gonna assess your shoulders, and we're gonna do some range of motion, okay? Since we already assessed the skin and palpate it and inspect it. So we're gonna flex, extend, hyperextend. Good range of motion in your shoulders. And let's check for strength. Keep your arms straight. Push up, push down, and sideways, and in. Good range of motion and good strength, +5. And I would do it on the same arm, on the other arm as well. So good strength in all upper extremities, +5. So I'm gonna assess lower extremities now. First, I'm gonna inspect. The skin is pink, it's warm and dry, it's smooth, no swelling. Any pain or tenderness? I'm gonna do your toes. Any pain or tenderness? And ankles, and the knee, and the hips. No pain or tenderness, and there is no swelling, and I'm not feeling any crepitus or deformity, no nodules or lesions. Let's do, can you lay down? We're gonna do some range of motion. Okay. All right, so we're gonna do range of motion of your toes. Can you flex and extend and adduct and abduct? Good. Okay, good range of motion. And we're gonna do your ankles now. Can you dorsiflex and plantar flex? Good. And rotate and invert your soles. Yep. And outward. Okay, good range of motion in your toes and in your ankles. I'm gonna assess for strength. Push up, push down. Good strength, +5. And we're gonna go to your knees. Knees we'll already assess and inspect. So we're gonna do range of motion. I'm gonna have you bend and extend. Okay, good. And we're gonna check for strength. Okay, bend your knee, push down. Good. Push up, very strong, +5. Good, strong girl. Okay, and we're gonna move to your hips. We're gonna keep your legs straight. Push up and down and adduct and abduct. Good range of motion in your hip. And keep your legs straight. I'm gonna assess for strength. Okay, keep your legs straight. Push up against, good, and push down and push sideways. Okay, and then good strength, +5. All muscles, strength, +5. Okay, I'm gonna have you sit up, and now we're gonna assess your tendons, deep tendon reflexes. Okay, so I'm gonna have do, we're gonna do brachial first, relax, and I see the muscle contraction here, and we do biceps. Rest your hand here, and I see muscle contraction here, and now we're gonna do triceps. Rest your hand, and I see the muscle contraction. So we did brachial, radial, biceps, and triceps, and all tendon reflexes +2. I would do it bilaterally. Good tendon reflexes. We'll do your lower extremities now. I'm gonna do patellar. Okay, +2, and I would do it bilaterally, and we'll do Achilles. Rest your leg here. And I see a good muscle contraction here. So Achilles tendon +2 and patellar tendon reflex +2. Good. So we're gonna do position sense. Can you lay down? Just tell me where I'm moving your toe.
Up, down,
Good position sense. And on your finger.
up, down.
Good position sense. Okay, sit down. Sit up. Now we're gonna assess for vibratory sense. I need your hand, and we're gonna do it over all our prominence, thumb, and your fifth finger. Can you tell me what you're feeling?
Vibration, 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 vibration.
Good. And we do the same thing on the leg. We'll do over the medial malleolus and the great and fifth toe. Oh. Tell me what you're feeling.
Vibration, 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 vibration.
Good. Good vibratory senses. Okay, now we're gonna assess for, I'm gonna stand up. I'm gonna check your spine. Okay, your spine looks midline, no scoliosis, lordosis, or kyphosis. Can you bend forward as much as you can? Good. And I'm seeing the spine is midline, no scoliosis. Okay, and stand up. So, and I want you to perform some range of motion for me. Tip to the right, tip to the left, and rotate. Good. Good range of motion in your spine. Very good. We're gonna assess your cerebellar functioning now. I also forgot to do thumb up positioning, but we're gonna do it now. Okay, so do thumb up position. Good, good. And now we do hand flip flop and change your hands. Okay, good cerebral functioning. All right, so now we're gonna assess your gait. I want you to put your feet together, close your eyes. We're gonna do Romberg's test. Close your eyes, and I'm gonna wait. Patient does not sway. Good, 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 steady gait. Okay, open your eyes. I'm gonna have you walk 7 steps, about 7 steps. Okay, good steady gait, good balance, hang, swing in a position. Come back on your tiptoes. Okay, and turn and go back on heels. Good, and now we're gonna do tandem walking, heel to toe. Good, good gait, stable, balance. All right, very good. So now I'm gonna have you sit. Oh, I'm also assessing for varicose veins, and I'm not seeing any signs of varicose veins. Have a seat. I'm gonna do a couple more tests. We're gonna do stereognosis and graphesthesia. So I'm gonna give you something. Close your eyes. Can you identify?
Penny.
Good. Stereognosis is intact, and I'm gonna write something. Tell me.
Figure 8.
Good. The graphesthesia is intact. Okay. All right. So we did assess. Let me just think a second. And I asked you 3 words.
Apple penny table.
Good. Good. Recent memory. Let's see. We did common science. We did cerebral functioning, and we walked, assessed your gait. Common science. Okay. So it seems like we have concluded our exam. Thank you very much. Unless I remember something else.